Hello, everyone. My name is Maddie Torres. I'm a FNP student at Roberts Wesleyan University. This is my presentation titled Interprofessional Collaboration for Evidence-Based Proper Bowel Preparation. The point of this presentation is to demonstrate how effective bowel preparation and interprofessional collaboration, when used together, they improve patient outcomes, enhance procedural accuracy, and reduce the need for repeat colonoscopies. The covered topics will include proposed change in settings, interprofessional team, collaborative strategies, communication strategies, and lastly, the FNP role. All right, the project overview and setting, asking what are we trying to change here? So we're trying to improve the quality of bowel preparation for colonoscopy patients. And by doing this, we're hoping to implement a nursing-led intercollaborative evidence-based educational support program and team. And asking ourselves, why is this change needed? Well, inadequate bowel prep in current practice, according to research, can lead to high rates of misdiagnosis, repeat procedures, delay in care, and increased healthcare costs. This proposed implementation will take place in a small rural hospital where the patient population is primarily older adults. And the characteristics within this setting that will strengthen intercollaboration include a tight-knit care team, strong nurse-patient relationships, and opportunity for impactful patient education. And the weaknesses that can hinder intercollaboration include limited access to specialized GI services, resource constraints, which primarily consist of having not enough staff, not enough time, and just not the proper equipment, and then varying levels of health literacy within the patient population. All right, this next slide is what the interprofessional team will be made of to enhance the bowel prep. As you can see, we'll start off with the family nurse practitioner. Within that role, the FNP will lead the patient education. They will oversee the implementation and they will evaluate the outcomes. The pharmacists on the team will review the medication interactions. They will actually recommend bowel prep regimens. And a really important one here is that they will ensure that there's availability of such prep given to the patients. The staff nurse, their job will entitle to deliver the patient instructions, reinforce the education, and can assist in monitoring compliance of the implementation strategies. The gastroenterologist, their job would be to provide clinical guidance on the bowel prep standards and also evaluate the prep effectiveness. And then the last member of the team is an IT or EMR specialist, and their role would be to integrate prep protocol and reminders into the patient portal and the electronic health records system. This next slide talks a little bit about decision styles, making styles, communication roles, and how are we going to evaluate and measure success within this patient population. The best approach for decision making will be shared through decision made through shared decision making and consensus building during structured planning sessions. Each discipline will contribute its expertise, and while doing this, that really allows to ensure that a patient-centered approach is taken. And another important aspect is the patient and the patient's perspectives and barriers like literacy and access. And that's going to be integrated through feedback from intake and follow-up. The coordination, the roles in the communication, The communication will happen bi-weekly with the interprofessional team. The task assignments will be based on the role of the expertise. And I threw some examples in here, like as I stated before, the nurse will provide the education, the pharmacist will adjust the prep, make sure that it's available, the gastroenterologist will be helping with the making sure that it's working correctly. The FNP is the one who initiates the role, things like that. And the communication will be shared through an EMR platform. This will allow the team to track patient prep status, share any sort of documentation, and a very important role here, will be able to communicate updates and concerns in real time. And how are we going to measure the success of this program? One of the more common bowel prep quality scores is called the Boston Bowel Prep Scale, which would be specific to the provider actually doing the colonoscopy. So more than likely the gastroenterologist will be using this scale. We will look at colonoscopy completion and repeat rate. We will take into consideration patient satisfaction and comprehensive surveys so we can see if the information that we are presenting to them, they're actually comprehending it. And once the team uses all of these different success measures, they then have the job to use this data to guide continuous improvements and adapt the protocols as needed throughout the implementation period. This next slide talks about communication and the team dynamics. We'll start with development and the team charter and the roles. So a team charter is going to be created and which will outline the clear roles, the responsibilities, and this will be developed from the beginning so the team is aware of their expectations from the start. A standard protocol will help ensure timely and consistent information sharing among the teams. As far as participation goes, I'm hoping that we have an equal voice and engagement. So having structured meetings and open communications like those shared chat boards or those weekly get-togethers, that will help everyone feel included in the project and encourage active participation from all the team members. And this just approach allows that everyone's voice is heard during the meetings. Another very common practice to promote engagement and participation among your team members is active listening. Active listening emphasizes on listening, respect, and inclusivity in all interactions to promote psychological safety and collaboration. And leadership will rotate or it will be delegated by the project phase, depending on the stages of the implementation. Like that would make sense, right? We would want the person who specializes within that portion of implementation to kind of take the lead and guide the other team members. And unfortunately, you do run into conflicts when you're working within teams. So they will be addressed using a respectful dialogue and a facilitated discussion. Specifically, conflict that does arise will be handled with the use of a neutral facilitator, which will be outlined and represented very early on. There will be a timeout or a cooling period if a situation does get a little heated. We will say, okay, let's time it out. Let's take a few minutes to relax and cool off. And also the use of a structured conflict resolution model, specifically the DESC script, which talks about describe, express, specify, and the consequences of such action. The last slide is the family nurse practitioner is always almost seen as a cornerstone of the interprofessional success. And this is the role that the FNP can play to promote that. Care coordination is really big with the FNPs. They bridge the discipline to the streamlined patient prep and procedure flow. Within care coordination, FMPs ensure timely communication between the providers, the nursing, the pharmacists, and the support staff. Patient advocacy, FNPs serve as the patient's voice in the planning and the decisions. They also tailor the prep instructions to individual needs, literacy, and the barriers. FNP's role is holistic and patient centered care. FMPs address medical, educational, social, and emotional factors, including prep success. So they take a more holistic approach to the prep success instead of just looking at one specific thing. They're really, really well at putting all of that together to create that whole picture for the patient and the outcomes. FMPs also promote adherence throughout empathy and individualized support. And FMPs and their responsibilities and leadership and communication and collaboration, they are able to lead the team meetings and facilitate the shared goals. They ensure proper protocols are very importantly evidence based and they're consistently followed. And they model respect, open communication to strengthen the team's unit to make sure that everybody understands that we're all on the same page. We want to look into the research, see what it says. We want everyone to feel open and comfortable with what's being presented. That is my presentation. I hope you guys enjoyed it.